just let me breathe into this episode. Friends, I'm sure you can see my frustration. It's right up here with me today. Why am I 70 years old and still wondering how to exist on this planet in a way that doesn't include pain and suffering every single frickin' day? I cannot seem to get the same two answers out of any two doctors, and I'm failing to understand what's happening in my body without help. If you're in the same boat, then let's have a little chat about it today, since I don't hear anybody else talking about the white elephant in the room. Being a woman on this planet as a second citizen. And we'll talk about finding some remedies outside that doctor dance. Right after the intro.
Welcome to Season 5 of the Cannabis Truth Podcast. Your host is Honey Smith Walls, author of the new book, Healing Beyond High, Cannabis Truth, a gentle, practical guide for elders to learn cannabis fundamentals safely and effectively without overuse or overwhelm. In a world where the FDA has yet to stamp its approval on this ancient natural remedy, Honey Smith Walls bridges the gap between Western healthcare norms, uplifting benefits and relief through gentle cannabis plant therapies. Join this 21st century cannabis shaman, uniquely positioned to assess the green intentions of medical, farming, and business industries in cannabis and uncover fascinating historical, political, scientific, and spiritual facets of the plant.
Hey, my friends. I'm so glad that you're joining me today. I have so much on my heart to discuss with you. So much for you to consider that you won't hear in a primary physician's office or even a specialist's office like a GYN, gynecologist, or a doctor who takes your what more seriously than most. That's also the specialist that you'll get sent to if you ask your primary about hormone replacement therapy or HRT. Wait, what? We're not talking about cannabis today? We're talking about hormone replacement therapy, HRT? Just wait. If you're a woman with questions about HRT and you ask your regular doctor about it, they might check your thyroid, but for anything else, you get sent to a specialist, an OB, obstetrics, GYN, gynecologist. If you're not pregnant, then it's not going to be the OB-YN part, the OBG part. It's going to be the GYN part. That GYN usually starts off with a long history of everything you've ever experienced medically, followed up by an exam of your what before ever discussing what using HRT might do for you. Hormone replacement therapy. Before I go any further, I just have to say, you're born with hormones and they fluctuate wildly depending on what you're doing as a human being, which gender you are, what your body is going through, what you're feeding it, what your emotions are doing to you, what you're suffering, what you're experiencing in pleasure. All of it matters. But they don't talk to us about it. Every time I would go to a specialist, a GYN, to try to talk about my hormones, the first thing they would do is see how tall I am, measure my weight, take my blood pressure, find out all of my history from the time I was born. And then they're going to throw me up there on that table and check out my what. before they ever discuss their philosophy in hormone replacement therapy or what they learned at med school in hormone replacement therapy. Doesn't matter if you don't know that that information might be 100 years old. We are not getting new information about hormone replacement therapy for women. And you know what that shit does? If we don't manage it, it makes us crazy. I'm just saying it out loud. Wild mood swings, hot flashes, just all kinds of things that I'm too upset right now to even to list. Let me get back to my episode. I stopped following that procedure about 10 years ago, and I'm 70 now, just saying. And I say that a lot just to let everybody know how well I'm doing as a 70-year-old on this planet. As an example, either I'm doing better than you thought you might be doing at 70, or I'm doing worse than somebody at this age. Only you can tell. It is so difficult to find information about this subject to trust and understand. And if the doctor wasn't going to help me regulate my hormones, then no point pulling my panties down, is there? If you don't understand what's keeping your hormones in balance, if you don't understand what that does, that's not your fault. You just weren't taught. And neither were those doctors, by the way. Or they'd be discussing it with you because it's so damned important. But they don't know. Why not? They weren't taught. Why not? You figured that one out. All I can say is it's a man's world, especially in the medical system. Again, you haven't been taught anything about this, and neither have the doctors that you've seen. And so they ignore it like a huge white elephant. They pass the subject off to someone else, a specialist who works on all of that, but maybe with very old information. Oh, okay. So we have to see a specialist. But when? When do we need to go see a specialist to balance our hormones? Because I was told before I started my period, around the age of 12, that my hormones would fluctuate wildly. Oh, hello, cramps and mood swings and depression and bloating and acne and fear. Those are all caused by my hormones. So when do I need to see a doctor? My period is supposed to be a natural process for girls becoming women, but my 9-year-old granddaughter is not ready to become a woman, except her body is ready to change. We could surmise all kinds of things about why that's true at such a young age, but it's just part and parcel for this generation. I thought I was young to start my period at 12. The other girls in my class didn't start until 13 or 14, so nobody took me to a doctor for starting my period. But my hormones kicked in and flooded my system every month. You know what they did for me? They gave me an aspirin. Later, it turned into a Motrin and a hot water bottle. And I finally got to switch from using those stupid, messy, and awkward clip-on feminine napkin belts to shoving tampons up my what and losing them for days on end. Still, nobody explained what's best for hormonal balance during this delicate time of youthful ignorance and pain. Just take a Motrin and go to bed with a hot water bottle to curl up around for the cramps. We suffer in ignorance and learn to feel guilty for having such wild reactions to everyday common stuff that shouldn't bug us. But our hormones are overactive, and there seems to be no relief from these angry, tearful, fearful feelings that take over our mind and mouth. But those feelings change our personality, and others begin to see us differently, even cautiously now. And we just want to be treated fairly and with respect, but nobody respects that elephant in the room. Nobody is teaching little girls how to balance their hormones during that most tender coming of age, but instead ignores the elephant in the room. Our hormones. Take a couple of aspirin and go to bed. Maybe a tummy warmer. Then get over yourself and come back to the world with a smile on your face. Don't talk about it. It's private. Don't talk about it. It's private. Gosh, I'm such a blabbermouth. I've got a podcast and I talk about cannabis all the time. But now all I want to talk about is beta-caryophyllene and your product, because it has given me my future back. I want everybody to know about this because, for heaven's sakes, I've never seen anything like this product in the prescription world.
How does it compare with cannabis?
I'm quite surprised. Oh, I'm quite surprised because cannabis didn't do it for me. Beta-caryophyllene did. And if you know the real truth about both products, they're both terpenes. Cannabinoids are really terpenes. I just am surprised that even though I had all the compounds in cannabis, it was a concentration of beta-caryophyllene that really did the trick for me.
This has been fabulous, and I really appreciate it. I want to get it out to everybody, too. I want to get it out to the whole world, as a matter of fact. It has so many mitigating factors for all the stresses of life and pain and diseases. It is unbelievable what the spectrum of care that it can provide.
I guess you can tell I'm really tired and upset over all this realization. Our medical system has ignored women's hormones for so long that we've suffered needlessly because of our American sick care system, which is not proactive for health. It's reactive for symptoms of sickness. I'll bet you can see where symptoms of sickness come into play from our American diet. That's a no-brainer. So until you get your food intake right, oh puppies, shh, 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 shh. Until you get your food intake right, trying to adjust your hormonal balance may be even more difficult. And by getting your food right, I mean more fresh, unprocessed foods, less meat, less salt, less sugar, and less caffeine. And of course, caffeine comes in more than tea and coffee, comes in all those sodas you drink. And then daily exercise, at least 30 minutes of it. But nobody pounds that simple mantra into our heads on a daily basis. No PSAs growing up to remind us we need to watch out for ourselves every day by what we eat, by what we drink and consume into our minds. Just a steady diet of fast foods and quick and convenient processed junk food from the grocery store, designed to make life quicker and easier, but it's also harming our bodies, friends, from all the extra chemicals added for color and preservation and sweetness. Stuff that affects our hormonal balance. So how do we figure all this out? Our school curriculum doesn't help. You might be able to decide something if you study hormones in college, but I didn't choose those courses. Where can I learn about this? Who can I trust to give me absolute information when I can't even find two GYNs who agree on the subject or have answers to my arguments? Like using HRT strengthening the myelin sheath around your heart, preventing a heart attack. So taught me by the amazing Dr. Janester Wilson King in Orlando, Florida, my wonderful gynecologist who was helping me back then before I had to move. or the fact that we can avoid Alzheimer's by keeping our hormones in balance. Why the hell aren't all women on HRT? Old information at medical school. Hang on. Millie needs help getting up on the bed, and she's my 75-pound Labrador that just strained her back the other day. So let me help her. Come here, honey. Come here. Come on. Come on. Come on. Come on. You can do it. Come on. Have to get up for this. Come on. Oh, yeah, there she goes. Okay, now scoot over because I have to be here. That's right. If you've been following me for any time, you know that I've got 5 little wolves in a pack. 3 cats currently at the time. A turkey, bunch of ducks, 2 grandkids. Order of importance is not necessarily listed. Shh. Okay, you guys be quiet. Back to what I was saying. We were talking about finding a GYN who has current information about HRT. And just let me remind you that in 1964, after the elucidation of THC and CBD, the 2 main components, the 2 main cannabis molecules in the plant, THC and CBD, delta-9, tetrahydrocannabinol, and cannabidiol. Those are the 2 compounds that grow the most in cannabis. That's why we talk about them all the time. But there are hundreds of other compounds. We're just now elucidating all those other compounds. And we have yet to discover what they all do medicinally, but we do know that the human and animal body loves cannabis molecules for the medicine that relieves us. All this new information about cannabis that's coming out has to replace all that old information that medical doctors and other medical professionals and scientists and the public have gotten a steady diet of that's anti-cannabis. We now know that all that bullshit about cannabis was politically charged. So now we have to come to the truth of cannabis, just like we have to face the truth of hormones and hormone replacement therapy. If our hormones are fluctuating as females on this planet from the time we're born until we die, why the hell aren't we doing something to regulate them? So, finding new information to trust about being a woman on this planet ain't easy. It ain't easy. There's a lot of study that goes into this. And of course, you don't have time for it. You need the cliff notes on being a woman and the medicines that we need to use to be a woman on this planet. Because life interrupts everything else. So unless you're trying to become a medical specialist in this field, women are just up shit creek. And that's why I'm talking about it. I want you to talk about your hormones to your mother, your grandmother, your granddaughters, your daughters, your friends, your aunts, your cousins, every frickin' body, and especially to your primary care physicians, and tell them over and over and over again until they get it that you need reliable references to good, new scientific information about women. Can't keep going off the old stuff. It doesn't work. If we were, are they still giving women horses' urine? Premarin to control their hormones? Jesus Christ. So, I want to remind you that in 1964, after the elucidation of THC and CBD in cannabis, the endocannabinoid system, otherwise called the ECS for short, was discovered. What the hell's your endocannabinoid system? First of all, let me just say, you may already know this, but we have 12 bodily systems which work together to maintain health and function. Up until recently, they only knew about 11. I'm going to name them. The first one's your circulatory system. It transports blood, nutrients, oxygen, carbon dioxide, and hormones. Second is your respiratory system. It facilitates breathing and gas exchange. Third is your digestive system. It breaks down food, absorbs nutrients, and eliminates waste. The fourth is your nervous system, which controls both voluntary and involuntary actions and sends signals between different body parts. The fifth is your muscular system, which allows movement of the body and maintains your posture. Sixth is your skeletal system, which provides structure, protects organs, and produces blood cells. Seventh is your endocrine system, which regulates your body functions through your hormones. Eighth is your urinary system, which removes waste from the body and regulates water balance. Ninth is your reproductive system, responsible for producing your offspring. And 10th is your lymphatic system, helping the body fight infection and maintain fluid balance. The last one that the medical professionals learned about was the integumentary system. The integumentary system. Integumentary. 6 syllables. Those scientists. Integumentary system, which comprises the skin, hair, nails, and glands, protecting the body and regulating temperature. These systems interact to keep the body functioning properly. Now, I only named 11 of them. And that, as I said, is all that doctors knew about until the recently discovered endocannabinoid system. Endo meaning within, Latin for within. Cannabinoid, yes, meaning cannabis molecules. System meaning it's got some sort of communication thing going on inside because it communicates inside of us. And, oh, by the way, it is also a master regulatory system governing the other 11 systems. It's been understood in science now for over 25 years. And yet most doctors on this planet don't know a goddamn thing about it. It is so frustrating to me. You now know more about it than the GYN I just saw yesterday. And it's abhorrent to think about. Cannabis and the endocannabinoid system still not taught in most medical schools because of the politically charged Schedule I rating. But all those big pharma controlled diseases and their commonly prescribed medications that tout death and disease as possible side effects are being taught. A flash of the last 25 years of big pharma prescription medications just came across my mind, along with all of those speeded up warnings that they try to dribble out at the last 2 minutes of the commercial. Yeah. It's freaking crazy. Why would I ask my doctor about taking a pill that gave me more disease, caused me more side effects, and could possibly cause my death? Why? It's utterly stupefying how Big Pharma has been able to bamboozle patients with their advertising commercials. And those side effects are like IBS and chronic fatigue and ADHD and Alzheimer's and dementia and inflammaging. Yes, our medical system is into sick care. And I don't want to play with them anymore. But I have to. I have to. I have issues that I can't resolve anywhere else. I thought for the longest time, and I can't believe I'm saying this out loud. For the last 6 months, my blood pressure finally dropped so that I could drop taking a blood pressure pill every day, which I've done for the past almost 40 years. But over the last few days, and I don't know why, it's been elevating. Maybe it's the subject I've been dealing with. Maybe it's residual flu. I just had the flu a couple of weeks ago, and it took me 2 weeks to get over it. Maybe it's the cut on my finger that was pretty deep and has been pretty painful. I've been medicating for it, but, maybe the pain from that elevated my blood pressure. I don't know what caused it. Maybe not moving for the past 2 weeks so much elevated my blood pressure again because I was in the season of flu. So I don't know what caused it to elevate again, but now I have to take a blood pressure pill for it. I called my primary care physician. I said, blah, 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 Actually, I checked in online with her, and that was pretty easy. And she was back commenting to me, responding within the hour. I was impressed. So, yeah, she said, yep, go back on them, honey. I'm sorry. So we'll see. I'll monitor. I took one. My BP has crept up to, like 190 over 104. Jesus Christ, that's heart attack area. So we really need to monitor what our bodies are doing as women. If you ignore it, well, you're setting yourself up for a shorter lifetime, I think. Like I said, I'm not saying I won't go back to a doctor. I just contacted my doctor this morning. But I will be looking for the right doctor to discuss my hormonal options with. My primary care is not that person. And even though she recommended the GYN that I just saw yesterday, she didn't know that GYN's real philosophy about HRT. And so took me 6 months to get that appointment with her. And then I had to take off my work yesterday and monitoring the Women's Spirit Festival that I've been involved with that's on for the next couple of weeks. Had to spend the time, money, and gas and frustration of getting there, only to find out that she had no intention of helping me because I don't fall into her category of old information. I don't mind telling you that I lost my cool and gave her both barrels about how fucking hard it is to be a woman and a patient on this planet, to find real information that will help me, and to stop being jacked around by doctors. I can't even find two GYNs who feel the same way about HRT. I'm in trouble. I don't know what to do. I'm searching for answers. And if you're ignoring that search for your own answers, like I said, hope you've got your will written. Because if you're suffering from moodiness, aches and pain, emotional issues that just won't resolve, hot flashes, headaches, and brain fog, oh yeah, check all that polypharmacy you're taking and consider gentle plant therapy, which your body already recognizes and tolerates well. And I'm not just talking cannabis here. I'm talking about finding someone who can really guide your intake decisions so that you'll have the best chance of surviving this planet feeling well and happy without fighting a constant inner turmoil, plus side effects from synthetic compounds. Do talk to your primary care physician about checking all your hormones and finding balance. Ask for a recommendation for an expert and consider finding that expert outside the typical American medical system. You know, like Chinese therapies are steeped in plants. Our bodies recognize plant compounds because of our complex, ancient receptor system. That ECS I was talking about, the endocannabinoid system of receptors. The last one, discovered only recently and still unknown to most American doctors because of our sick care system, because of old curriculum. Learn as much as you can about your body, my friends. Get on the internet on reputable sites discussing the subject. PubMed.gov is a site where I go often to find answers. But do your own research. Ask lots of questions, and don't forget that keeping your hormones in balance prevents heart attacks and Alzheimer's. Ask your doctor if they know about the ECS. That will tell you how old their information is. Because if they don't know about the 12th most important governing master regulatory body function called the endocannabinoid system of receptors, the ECS, then how old is their information on hormones? They're not going to be able to teach you without understanding it themselves. I'm on a new mission to find a doctor, probably a doctor of osteopath, who has a more holistic attitude about me as a whole woman and not just the symptoms I present. There they go. I need current hormonal information, not more Premarin made from the horse's urine like they used to give women to regulate their hormones. I know, I just can't believe that either. Some guy, scientist, thought that would be the right thing to do. Start figuring out how to balance your hormones, ladies, and talk to your daughters and granddaughters about it. You know, I'm speaking to women, but men have regulatory hormonal issues too. Just saying. You may not feel like your heart is planning to crack or that you'll lose your mind at a certain age, but the statistics are raging. And if I haven't said it enough for you to realize, using cannabis to assuage womanly shit we feel and suffer is a godsend to this planet. You'll want to feel like your emotions are under control and you're not going to lose your sanity if one more person comes near. Cannabis can help you feel happier, contented, calm, without so much pain, without so much anxiety. And don't forget, you'll need to learn the alchemy of cannabis for it to be effective for your issues. Precious, can you stop that, please, honey? Thank you. Good girl. Listen, I know this has been a lot. And thinking about using cannabis to help you feel better as a woman on this planet on a day-to-day basis, that may seem like it's totally out of your realm of possibility, but it isn't. Follow me. I'll help you through this. If you can add butter and syrup to pancakes, you can do this. I so love hanging out with you and passing on the wisdom of my experiences. This is stuff my mother nor my grandmother could not ever talk to me about. It was just our era and traditions not to discuss it. Just wouldn't allow. But it's a new day. We need to take proactive control of our bodies since our American medical systems and their philosophy is so backwards. Like I said, don't get me wrong, I'll go to the hospital if I need to, but I'm not going to rely on them to answer my questions about hormones, since for 70 years they haven't bothered asking. I'll find someone who's been studying hormones all their lives. I'll bet they're out there somewhere. I'm going to find them. I'll let you know when I do. Until then, Pax Vobiscum, my friends. That's Latin for peace be with you. See you next week.
You've been listening to another Cannabis Truth podcast with 21st century cannabis shaman Honey Smith Walls. It is important to use verifiably safe products and look out for yourself while we're in this wild, wild west of cannabis right now. Ask for help. It can get complicated. If you need serious medical attention, please consult one of the specialists at cannabisclinicians.org. They will get you to the right person and therapy for your issues. Tune in here for weekly foundational knowledge and learn to determine the best choices and cannabis strategies for your issues. But please be advised that shamans are not doctors or scientists. You'll find those at cannabisclinicians.org. Unless otherwise proven by a reputable third-party lab test, please regard all street weed as contaminated. It may do grave harm to a patient with a delicate immune system who already has inflammatory issues like arthritis, IBS, fibromyalgia, or worse. Thank you for your time today.